Hang on. So, hi, my name is Lorraine. I'm a student from the University of Louisiana for RN-BSM degree. I'm here to do a body assessment on you. First of all, can I ask your permission if I can videotape you for regrading?
Yeah.
Did you empty your bladder?
Yeah.
Thank you. So in this place, this position, I'm going to make sure that my client sleeps on supine position with the flat pillow and arms on the sides. I'll go ahead and provide privacy for my patients, and I'll make sure that the only place I'm exposing is the area where I'm doing my assessment, and I'm very much focused on the abdomen at the moment. Okay, so start by inspection. And this point, I'm looking to check the skin color. My patient here, the skin is a little dark and it's very symmetrical. Look at the umbilicus, which is centrally and symmetrical and inverted. Look at the no pulsation here, no peristation. Otherwise, if there were peristalsis, then we maybe will be like there's a bowel blockage or something. Otherwise, right now there's no redness, no rashes. I don't see any irritation, and no hernias, no masses. I don't see any stretch marks or scarring. The abdomen looks clean and clear. I'll go further. Check to look for the contour of the abdomen, which is flat in this case. I'm going to ask my patient to take a deep breath for me, and I'm going to check for any hernias or masses, and I don't see anything. Thank you. Next thing, I will ask you to state it for me. Thank you. And I don't see any hernias or masses which are exposed at the moment, which is good. Okay, I'll go further and do auscultation. In this point, I'll auscultate from clockwise from the right lower quadrant all the way to the left lower quadrant. And what I'm listening for is I'm listening for whooshing sound, which is for the vowel sounds. Active vowel sounds, which is normal. I can hear those at least 5 to 35 per minute is a normal finding. Okay, there are vowel sounds. The next thing I'll auscultate for vascular sounds, and what I'm listening to is renal artery bruises, the right renal artery, the other listening to the iliac artery and femoral artery. So I'll start by epigastric, listening for any bruises. I can hear bruises, no bruises. The right renal artery, no bruises. The left renal artery, no bruises. The iliac artery, no bruises. The left iliac artery, no bruises. Femoral artery on the right, no bruises. And the left femoral artery, no bruises. This way I was listening to vascular sounds using my bell, because those sometimes you can hear them very well using your normal stethoscope. Okay, I'll go ahead further to do percussion. And I'm going to percuss to check the liver border at this point. But first of all, I'll percuss to make sure that I define the area for the abdomen. And it should sound tympanic. Using my middle finger, percuss, I can hear tympani, tympani there, tympani, tympani. So I'll go ahead now, start doing percussing the liver, and I'll start from the lower right quadrant in the mid clavicular line, going upward. tympani, 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 tympani. There I can feel like dull. I'll mark there the area where it's dull. I'll go further, start from the upper. I'm sorry to expose you, but because of the privacy of my patient, I'm not going to expose the entire area, but I'll show exactly where I'm starting from the upper chest, going down, and from the lungs should sound resonance until where I can feel some dull. You can hear resonance, resonance, resonance. They are dull. So I'll mark the area and I'll go ahead and measure from the point. Which is 6 centimeters. And the normal liver should be between 6 and 8 centimeters. In this case, it's a normal finding. I'll go further again now to percuss the spleen. It should be on the left side, on the axillary line, mid axillary, around the 5th, the costal, or the 5th rib, or tympani, tympani. Around here is the spleen. Usually the normal finding is so hard to find the spleen because it's way behind. Okay, the next step now I'm going to do is to palpate. No, first of all, I'll percuss the kidneys to check for any tenderness. And I'll ask my patient to sit before I palpate to check for any tenderness. And at the severe causal vertebral area, I'll take my left hand with my right fist. Can you feel any pain? Can you feel any pain? No pain. So in this case, it's a normal finding. With a normal finding should be maybe with tenderness and might be an indication of infection or inflammation. So I'll go further now, palpate the abdomen. So starting from the right lower quadrant all the way, what I'm checking here is to feel for any masses, any hernias, or any tenderness or facial expression with any grimacing or guiding. And it should be like 1 centimeter, not too deep. Any tenderness there? No tenderness. These are normal findings, so my patient doesn't have any tenderness in any area. I'll go further now to go deeper, like 3 to 5 centimeters, and I'm assessing now here for any masses, any hernias, and see how. Take a deep breath. Okay. I don't feel. Do you any tenderness? No tenderness. Clockwise, there's no tenderness here, so it's a normal finding. I'll go ahead and percuss palpate the liver border, and if I'm able to feel the liver, and then could be maybe the liver is large. And you can take a deep breath for me, holding from the costal margin here. You can go deeper. With inspiration, I should be able to feel the liver, but I don't really do. It's normal finding. I'll go using my left hand. I'll go reach further to palpate for the spleen. Can you take a deep breath? Any tenderness? I don't see any tenderness. This with all that, usually if there was any, if we feel the spleen, that it means the spleen maybe is too large, and that's splenomegaly. Otherwise, thank you for letting me do this. I hope next time you allow me to do another assessment on you. Thank you.